Hi, my name is Amanda Hashagen, and I'm going to be filming my video physical assessment. And first, I'm going to ask permission. Is it okay if I film you for my assessment?
Yes, ma'am.
Okay. Upon entering the room, I'll make sure that I wash my hands really good, that I provide privacy, and that I have good lighting. I'm going to start by assessing her skin, the color, and the turgor. So her skin is nice and pink. Turgor is normal and it returns within less than 3 seconds, so we know that's okay. She has normal moisture. Her skin's not excessively dry. I'm going to look in between her toes for any abnormal moles or any lesions, any rashes, and everything looks normal. I'm also going to examine her nail beds, and they are nice and pink, as well as hair distribution, which is normal. I'm going to assess her skull and palpate for any nodules. And then I'm going to inspect her face for symmetry. I'm going to have her smile. Her smile is normal and symmetrical. I'm going to palpate her sinuses. I'm going to start with her frontal. And then I'm going to start some light palpation. Are you having any pain with that?
No, ma'am.
And so that would be a normal assessment for her. She didn't have any tenderness with palpation or percussion. Next, I'm going to assess her pupils. I'm going to make sure that her pupils are nice and round and equal and reactive to light on both sides. And they are. Next, I'll check her ears and just make sure that I don't note any drainage, any redness, no lesions, as well as her nose. I'll make sure that she doesn't have any abnormal drainage, no ulcerations, and they all look normal. Her lips are normal color, and they're moist, and as well as her mouth. I'll look at her oral mucosa and make sure that it's nice and moist, and it is. And then I'll start to palpate her neck and check her lymph nodes. I'm checking for any tenderness or swelling, enlargements. Her trachea is midline, it's normal. And next I'm going to listen to her carotid artery. I'm going to listen, and then I'll palpate. And I'll just do one side at a time. And then I want to compare her carotid pulse as well as her radial pulse. And they are good and strong and equal. They also have the same quality. Next, I'm going to assess heart sounds, S1 and S2. I'm going to listen. Start at the second intercostal space to the right, and I'll be auscultating her aortic valve. A little lower to the left, her pulmonic valve. And then down to the second intercostal space, the lower sternal border of the tricuspid. And then the mitral valve is at the apex. And her heart sounds are normal. And then I'm going to palpate at the fifth intercostal space the point of maximal impulse, which is also normal. Next, I'll go ahead and move on to her lung assessment. And I'm going to start listening side to side. And I'll be asking her questions. First, I'll listen anteriorly. Have you had any shortness of breath?
No.
Any coughing?
No.
And I'll have you set up, and I'm going to listen to her posteriorly, side to side. Okay, and you can lay back. And her lungs are nice and clear to auscultation, no bronchi or wheezes, and no cough. If she did have a cough, I would ask her what color her sputum was, and make sure that I assess that as well. Next, I'm going to inspect her abdomen. First, I'm just going to look for any rashes, check the for any lesions or scars. And I note that she does have a low transverse scar here. Did you have a C-section?
Yes.
Okay. From a previous cesarean. I'm going to go ahead and listen to her bowel sounds. I'll make sure to auscultate first before I palpate. I'm going to listen for a full minute, all 4 quadrants. Her bowel sounds are normal. I don't hear any high-pitched noises or abnormal gurgling. And then I'm going to palpate her abdomen, and then I'll make sure I watch her expression to make sure she's not having any abnormal tenderness. And she's not. So then I'm going to go ahead and move along to assess her arms and check for edema. I also want to look at symmetry, and they're nice and equal. She doesn't have any abnormal swelling. Her legs, I'm going to check for swelling by palpating with my thumb on her shin. And she does not have any pitting edema. Next, I'm going to check quality of her pulses, and I'm going to start with her femoral pulse. I'll palpate both sides at the same time and make sure that they are equal. And then I'll move down to her popliteal pulses, just behind her knee. And they are also normal and equal. And then down to the dorsalis pedis, which is at the top of the foot. And they are also equal and normal, as well as the posterior tibial pulse, which is located at the inside of the foot. Next, I'm going to look at her musculoskeletal system and look to see that she has good alignment of her shoulders, her hips, and her knees. She has good symmetry. There's no swelling. There's no warmth in her legs. Any tenderness when I flex?
No, ma'am.
Can you flex your neck forward and back? No tenderness with that?
No.
Okay, and now I'm going to go ahead and move on to her cranial nerve assessment. And first I'm going to start with the olfactory nerve. I've saturated this cotton ball in a liquid, and I'm going to have her smell it and tell me what she smells.
Vanilla.
And that is correct, so she passed her smell test. Next, I'm going to move on to her vision, and I'm going to be using the Snellen vision chart. And for sake of time, I'm only going to have her read the lowest line, the smallest line that she can read. Normally I would have her do one side at a time, but she's just going to do.
Okay. Star, plus, circle, heart, and a flag.
Okay. So her vision is 20/20, and that would be normal. Next, I'm going to palpate her jaw and have her move her jaw. And her trigeminal nerve, that is, we know that's normal. Her response is good. Her facial nerve, I'll have her smile, raise her eyebrows, okay, and they are nice and symmetrical. For the hearing test, I'll do, I'm going to whisper 2 words in her ear, and I'll have her tell me what they are.
94 in baseball.
And that is correct. She passed her hearing test. For the glossopharyngeal nerve, I'm going to have her swallow. And I'll just make sure that looks normal. It does. And also we would check for hoarseness. And she haven't noted any hoarseness in her voice. For the spinal accessory muscle nerve, I'm going to have her shrug her shoulders against my hands. And we know that that's normal. I didn't feel any signs of weakness, and they were symmetrical. And then last, her mental status, I'll assess by asking her the year, the day, and where she is currently. Do you know what year it is?
2016.
And the season?
Summer.
And the day, month, and year?
August the 10th, 2016.
And you know where you are?
In Storrs Draft, Virginia.
Okay. And that is all correct, so that concludes my assessment video. Thank you.